So who doesn't want to use cream before coming to the class? Everyone uses? Majority of you. So what creams do you apply? How many are for fair and lovely? All of you? Fair. Any other creams you know? Pond's, lactocalamine, so many creams are available in the market. So why do we need this? To produce glow on the face. What else? Do you know any other creams we apply other than for face? Body lotion. Other than body lotion. Sunscreens, yes, very good. Sunscreens, body lotions, facial creams. Anything else you know? For wounds, what do you apply? Wounds, cuts, what do you apply? Covidine iodine ointment, saffromycin ointment. Yesterday we told silver, sulfadiazine ointment. So many ointments are available. Do you know any creams which we apply? Facial creams are there. Have you ever heard of Whitfield ointment? Not heard. For viral warts and all, we use Whitfield ointment. Anything else you know which comes in TV? Itch guard. Have you seen it? Okay. So itch guard is also a type of cream. Have you heard of shampoo for dandruff? What is that? Head and shoulders. What it contains? What it should contain ideally to act as an anti-seborrheic dermatitis, or commonly called as dandruff. What it should contain? It should contain some antifungal agent. Okay. So what are the antifungals which can be used topically? Antibiotics which can be used topically. What are the skin soothing agents, the sunscreen agents which can be used topically? Today we will be learning something about that. Okay, what is the difference between ointment and creams? Which is better? Ointment is better or cream is better? Like that. Both are good. Anything else? The most common thing we have not discussed. What is that? Acne. Acne vulgaris. Which cream do you use for acne? Yes? Yeah? Clindy, cleanser. Yes? Anything else you know? Any other popular names for acne vulgaris? What do you want to use? The basic content is clindamycin cream. Okay. So along with that, they use this benzoyl peroxide. So today we will be learning about the diseases of various skin layers. Okay. So this acne and all will be the diseases of this epidermis and the dermis, the epidermis and dermis. Then the diseases of this hair follicle, where the infection of the hair follicle will take place, and swelling will be there. The sweat gland block can be there. Okay, here you can see the sweat gland. So when the sweat gland block is there, it forms a swelling. Okay, this will be the deep-seated painful swellings. Okay, all these issues, whatever we are saying, hair follicle, epidermal infection. So I have seen this wheel and flame reaction after the consumption of any allergic items. Whether it will be disease of epidermis or dermis, it will be superficial. So it will be for epidermis. Then have you heard of the disease psoriasis? So where the problem lies? Which layer? Is it superficial? First two layers? There is more proliferation of the skin in this condition. So here will be the disease, epidermis and dermis. So the common terms we use here are demulcents. Demulcents is a common term for skin soothing agents. Okay, these are the inert substances. That means they themselves do not have much of pharmacological property. It soothes the inflamed or the denuded mucosa of the skin by preventing contact with the air and the irritant surroundings. Okay, so whenever the skin is eroded, on that skin if you apply this alcohol, it will be burning. Okay, initially we may apply it to cause what? Yesterday we have learned what we call for wound cleaning, wound debridement, or any other term we remember, decontamination. So that for that we use the alcohol or the hydrogen peroxide or coordinating section. After that we need to cover that skin so that it is not further exposed to the atmospheric irritants. Okay, maybe the dust or anything else. Then we can cellulose. Okay. Nowadays most of the eye drops, okay, because we are exposed to a lot of dust and eye irritation is more. Methyl cellulose content of this eye drops is increasing now. They are costing 100 rupees plus. Okay, so ciprofloxacin or any other NSAIDs are added first. Then they are going to the artificial tears also. For artificial tears we use this methyl cellulose also. Okay, so propylene glycol, then glycerin. Yes. Have you heard of this glycerin film? Soaps are available, creams are available. What else? Where else we use this glycerin? For mucous membrane. For mucous membrane where do we touch? Oral cavity. Which type of disease of oral cavity we use? After ulcers. Okay, so after ulcers we can use glycerin. Nowadays what else we are using for after ulcers? Yesterday we have already learned it. Okay, chlorhexidine preparations are available. Okay, chlorhexidine preparations are available. Then we are adding 2% lignocaine now. Okay, 2% lignocaine oral gels are available because the after ulcers are very painful and they have to eat to survive. If it is a lot of pain in the oral cavity, they may not be able to take the food. That's why what we tell the patients to use this after ulcer gel which contains this chlorine and also lignocaine and also this glycerin. Okay, so that the pain will decrease, they can eat. Emollients. Okay, so emollients you can see here it is liquid paraffin, olive oil, sesame oil, cocoa butter. So have you used olive oil? So more costlier in the market, olive oil. Okay, they use it for children's. Okay, so children's it softens and soothes the skin. Okay, so olive oil and liquid paraffin. Have you heard of this term? Liquid paraffin. Yes. Anywhere else it is used? Where liquid paraffin is used? If you consume this liquid paraffin, it will act as a purgative and laxative. Okay, so purgative and laxative preparations contain this liquid paraffin, and also the recent preparations of this calamine lotion. Okay, and calamine lotion for psoriasis, calamine lotion for dry skin in the winter. They use a combination of calamine plus liquid paraffin for soothing. This liquid paraffin is a petroleum derivative. Okay, the petroleum byproducts, what we call it as fractional distillation of these petroleum byproducts. Okay, we get Vaseline and also this liquid paraffin, which is having the property of giving an oily surface or it will soothe the dry skin. Cold cream preparations, they contain this. Then we have this absorbent and protectives. So no one told about aloe vera. So most commonly used. Okay, so aloe vera. It is more costlier. Okay, 10 gram bottle will cost you more than 150 to want to notice now aloe vera potency. Now where it is obtained, aloe vera? Aloe vera plant is obtained. What do you call it? Any other common name, local name? Okay, so everyone knows that. Okay, so that extract, for example, the plant extract, some of its extract will be costlier. Okay, even though it is available so commonly wherever you go in the countryside or village side, still the product is very costly because the extract of this aloe vera which is needed for skin strengthening, that will be costlier. Okay, so that's why it is costlier. Then boric acid, we have discussed about this boric acid. Where we have discussed antiseptics and disinfectants. Yesterday's class we have learned about starch. What is this starch? You know, the cloth should stiffen. What they use to stiffen the cloth? They use starch. Okay. So where else we are using this starch? It is a carbohydrate actually. So it can be used in weeping wounds. That means the wound where there is eczema. Okay, weeping wounds in that we can use this starch to absorb the secretions. Then calamine lotion, you know, most of the skin conditions may be the skin burns, maybe this sunburns or dry skin. Most of these conditions we can use this calamine lotion. Or naturally also, even though nothing infection is there, just to give moisturizing effect to the skin, we can use this calamine lotion. Then talcum hydroxylocation silicate, Pond's green flower powder. Most of you might have used it. Okay. So that is containing hydroxylocation silicate. It helps in decreasing the sweating and all. Then we have this magnesium zinc stearate, again a part of this talcum powders. What are these? These are finely powdered insoluble solids capable of binding to the surface and prevent this oily skin. We have discussed about this term astringents. Have you heard of this term astringents? So astringents are the substances which precipitate the surface proteins and prevent the underlying surface from coming into the contact with the atmosphere. Okay, for example, you have a wound on the hand on which we can apply astringent so that the surrounding sweat or surrounding dust will not enter this wounded surface area. Okay, so we can use common tea. Common tea which we drink is also astringent because it contains tannin, which is the astringent. Okay, so we have so many astringents available. We have discussed also about this zinc. Okay, in case of GI infections, for example, food poisoning has occurred, we are using the ORS preparation containing this zinc so that the bacterial toxin is suppressed from touching the intestinal mucosa and thereby prevent the stomach pain. Okay. So in case of this food poisoning, what has happened? There is a lot of toxin released from the bacteria and this will act on this intestinal membranes to raise the static AMP level, which will cause spasms of the intestine. Once we can cover this intestinal surface, we can prevent the further exposure to the toxin. Same thing can be done for the burns, and most common preparation which contains this zinc is calamine lotion. Okay, this calamine lotion we have zinc oxide to it. Okay, and one of the point of this zinc oxide is it provides the same color, a pink color which matches with our skin. Okay, so that will be helpful for us. Then we have discussed about this potassium permanganate. Okay, potassium permanganate, we told that the Epsom salt which can be applied on the wounds can absorb water, okay, and decrease the secretions from that wound. We told that this potassium permanganate at various concentrations can be used for irrigating the bladder, cleaning the water disinfectant. So many uses are there with this potassium permanganate. Then we have this rose solution. Then acetic acid 5%. What eczema is sometimes called as weeping wound. That means crying wound because lot of secretions are coming from this wound. Okay, most commonly it occurs in legs. Okay, those patients who are obese or mobility is less, where the blood is stagnant, we call it as weeping wound or eczema. In those conditions, astringents will be helpful. So once again, astringents are the agents which are precipitating the surface proteins and preventing the underlying surface from getting exposed to the outer atmosphere. Okay. So now we have the differences between creams and ointments and lotions. Okay. Creams, cold, except for cold cream, the creams which you apply on the face, what will happen? Will you have the oily face after applying the cream? Only if it is a cold cream, it can be oily. Otherwise, most of the creams, they completely merge with the skin. Okay, you will not have that chip feeling. Oily feeling will not be there. Whereas with ointments such as coating ointment, there will always be oily feeling. That means which is good, which is bad. See, it always depends on the area, depends on the wound which is there. Okay. For example, saffron cream may be good for some wound which are smaller, but povidone ointment will be good for the deeper wounds, deeper cuts, and where you need the antibiotic to stay there for longer time. Oil can stay there for longer time, whereas cream will not. Cream will be short-lived. Okay. So applies more easily. For that means even a small ointment you can apply with little massage. But here you need to massage longer time, or the oiliness will not be lost. You need to wash your hands thoroughly. So oil is dryness for prevention of the evaporation. Okay, that is very important in case of dry skin and all. Okay, the chapped skin what you see in cold climate. So here creams can penetrate well. Here it is needed for removal of the scales. Okay, the typical scales can be seen when you twist your skin. Okay, hold both ends, you twist your skin. Those are the typical scales which you can find. And these scales are more in cases of cold season. Okay? So here there can be drying. Creams may not be available in cold seasons. It will be better to go for ointments. And it is a water repellent because they are oily or greasy basis more. So here creams can be easily washed off, but not ointments because they are oily. Okay, occlusive, protective, they have soothing and lubricating effect also. Then coming to the lotions, what we are calling it as body lotions. Okay, here more water content is there, less viscous than creams. So they stand at the same, except for more water content is there in the lotions. Then coming to the counter-irritants and irritants. Gendu balm. What are balms in? Menthoplus, Gendu balm, all these things. So they are irritants and counter-irritants. Okay, they irritate the surface skin and they counter-irritate the deeper skin surface, where myalgia and deeper aching part will be, deeper pains will be relieved. Okay, so would be placing that irritant agent such as menthoplus, it can cause hyperemia and redness. We call it as lubrication. Okay, so there are preparations which will cause redness on the surface where you apply. So we call them as lubrication. Okay, here irritation is there as similar to our irritants, but also hyperemia is there. Okay, this sensory stimulation is both with the irritants also. Hyperemia is the one that is more blood circulation, which will cause redness of the surface. Where do we need such preparations? It is needed for sisters. Where? How do you apply IV cannula? First attempt, second attempt, third attempt. fifth attempt. See, she is to Priyanka is doing fifth attempt. See, the thing is, when you will be learning, okay, may not be learning. After 5 years of your service, you will be able to apply it at one chance. But what are the negative points? What are the chances that it will skip? There is always a chance, because eye canal, their eye fluid is oil, the patient may not be cooperative, he may be moving the things. What will happen at that side? Swelling will be there, okay? Swelling, and also there is extra recession of the blood. Now we apply an ointment which is ruby-patient to whole surface area. The whole surface area completely it becomes red. So the person may not be able to point out where the extra recession has to be placed. Okay, we use it for this also, and various other places also we can use this applications. So coming to the other counter-irritants, volatile oil, turpentine oil preparation is another. Eucalyptus oil. Have you heard of this eucalyptus oil? Have you heard of steam inhalation in times of cold? What do you use for steam inhalation? What do you put to the water? Vicks. Okay, that Vicks, it is a Ayurvedic preparation. You might be knowing. They also should contain some irritant. That will be, in place of Vicks, you can put this eucalyptus oil. Okay, so eucalyptus oil. Camphor. What is camphor? In Kannada it is Karpura. Okay, so camphor is also counter-irritant. Okay, so camphor can be applied on the skin. You know, some of the preparations, what you told as Menthol Plus or this Jendu Balm and all, they also contain this camphor. Oil of wintergreen or methyl salicylate. Okay, methyl salicylate, or it is also called as oil of wintergreen. They all are the capsicum. You know what is capsicum? Anyone got the chance to cut this capsicum in the home? No one cuts it? Only mother cooks it? You people do not do it? Okay, so if you do it, feel it. Okay? Keep your hands on both of them complete when it is cut. Okay? Keep both of your hands, rub your face. So that will cause irritation. How much? You will not be able to come out at least for 1 day. Okay, even from far distance you will feel that. Okay, capsicum is a irritant, strong irritant. Okay, so alcohol, again it is a irritant. Okay, alcohol can be irritant. What happens if you apply alcohol on the skin? You will feel cold. Why? It is. You don't know why? There is a term called latent heat of evaporation, because alcohol evaporates. Even though the camphor, some people keep them in their hand and burn it. Okay, there can be when there is something burning or evaporating, camphor can also evaporate. There is coldness actually which is created. So caustics and acid. Okay, so here we have this silver nitrate, phenol, PCA, trichloroacetic. So phenol we have learned. Okay, so phenol, where we are using antiseptics, disinfectants. Yesterday class was phenol for cleaning the halls, cleaning the rooms and all. And the negative point is they can cause corrosion of the iron surfaces. So we are not using for surgical instruments, but for cleaning the other surfaces. Silver nitrate. What? We got it for what? Silver can cause what? It soothes, it causes cold, given coldness. Where it is? Burns. Okay? So then we have this photochemical residue, and most of these are corrosive agents. Corrosive agents is that which can cause rusting. Then we have this keratolytic agent. Where we can use this keratolytic agents? All of you wear shoes. Okay, what happens to the lateral surface of the foot after wearing for a long time? There can be hardness. Some part of it. Okay, you may be wearing the soft shoes, but you wear the hard leather shoes for some time. What will happen to the lateral surface? There will be hardening. Okay, hardening and blackening of the medial and lateral malleolus will be there. Okay, so in those cases we can use a keratolytic agent. Okay, we can also use this keratolytic agent for warts. What are warts? Warts are viral infections. What do you call it in Kannada? Warts. On the sole of the foot, hardening will be there. What do you call that? There we use that keratolytic agent. It is a viral wart. Here is viral warts, wounds, calluses. You know, callus means on the sole of the foot. Old ladies who are weighing more than 80 kgs. What will happen? The skin thickening will be there, hardening will be there. Okay, so that is callus formation. Maybe if diabetic, it is more common. Okay, there we can use this keratolytic agents. The agents here are salicylic acid, lactic acid, urea, and sulfur. So these keratolytic agents are most commonly used for psoriasis. So then we have this resorcinol, which is antiseptic, antifungal, and local inflammatories. Urea again is a hydroscopic that is used with steroids. Again they find that in psoriasis or similar conditions. Benzoyl peroxide. So if there is a small acne on your face, your hands are very active, your fingers are very active. Scratching. Okay? Scratch it, what will happen? Thick skin will develop. Okay. Later it will become a dark spot on your face. Then you go to the doctor, they use an agent which can remove this thickened skin. The agent here is benzoyl peroxide. Okay, so that is the keratolytic effect. It is combined with this clindamycin. So antiseborics. So seborrheic means the common term used is dandruff. Okay, seborrheic dermatitis. This is the common term where it can occur. On the head, on the eyebrows, and also on the back. Okay, so seborrheic dermatitis, if you are not treated, it stays for a longer time. It can cause. It is a part of this fungal infection. Okay, like something like tinea papyrus. Okay, all back of the neck it can take. It can come to the back. Complete body it can take. Okay, so it will be cumbersome. It may not be that much dangerous disease as to kill the person, but it will be cumbersome. Okay, it will cause constant irritation. So what drugs can be used here? One is imidazole or the ketoconazole or antifungal K2 shampoos that we have discussed. Okay, other things are selenium sulfide, zinc pyrethrinol. These corticosteroids are like double-edged swords. These are immunosuppressants. One thing what can happen by using these corticosteroids is it can suppress the immune reaction against the seborrheic dermatitis. The inflammation can be suppressed, so that patient can get relief. But plain corticosteroids without any antifungal agent can be dangerous because they can cause more and more growth of this seborrheic dermatitis. So sulfur and coal are most commonly used for this psoriasis. Melanizing agents. Where do we use this melanizing agents? The agent which can darken the skin. What do you call a white patch? Vitiligo. Yes, vitiligo is the tendency. What else? There is lichen planus and vitiligo. If it is there for dermatitis. Have you seen the person complete white skin? Okay, this is the hereditary. It can be hereditary or can be acquired. You know, this ladies above 40 years, they apply a very strong band around their waist. They apply so strong that the skin starts eroding around that space, and there also vitiligo can occur. So this is more common in elderly people like 40 to 50 year ladies and 40 to 50 year male who wear very tight pants, very tight. It can also occur on the other parts such as post wound. Okay, for example, a wound is there, the hands are not clean, they start itching again, they remove again, they remove complete scalp again and again. What can happen? The skin can get decolorized there because we are not given enough time for the skin to form completely. So there can be vitiligo or a white patch. Okay, so there we are going to use a drug which can put the melanin. Melanin is the one which gives color to our skin. Okay, so that's it. We can use this solanine, ethoxylate and keratolytics. What we use to decrease this demelanizing agents? Do you know anything? After acne, there is a dark patch. You need to remove the dark patch. What cream you will use? What cream can you use there? Something you know